Well, we have breaking news right now. New Jersey Governor Phil Murphy is giving an update on the coronavirus outbreak. Let's listen in.
Residents of our efforts to protect them and our state, given the growing and rightful concern regarding the coronavirus and the COVID-19 illness it causes. First, to be clear, we currently have no confirmed cases of coronavirus or COVID-19 in New Jersey. Based on Centers for Disease Control standards, anyone with pneumonia requiring hospitalization with no other alternate explanatory diagnosis, like the flu, will undergo precautionary testing for the coronavirus. We have just been informed of one person who will be tested, and Commissioner Persicelli will speak to that instance. But to be clear, again, as of now, none of the individuals tested under this standard have been positive for coronavirus. The risk to the average American is low. That is a welcome relief, but we are not allowing ourselves to sit back in any way. We are committed to keeping state government in an active and engaged position to respond properly and swiftly to any future individuals who meet the CDC guidelines for coronavirus testing. This is a multi-level and whole-of-government effort. It includes our hospitals, our schools, and the personnel at our ports and airports. And others up here with me will speak to this. And our preparedness also includes our residents. We remain in close contact with our federal partners at the CDC and other agencies. In fact, several of us were in the White House on Friday. I spoke to Vice President Pence on Friday evening. I just participated, and many of us were with me, in a video conference with the Vice President, Federal Health and Human Services Secretary Alex Azar, White House staff, and governors from across the nation to discuss our national preparedness. And that's the reason why we're a little bit late. That call went on a little bit longer than we had expected. I was proud, as I was on Friday, to be able to speak with the Vice President and his team just now, and to once again engage directly in a dialogue to ensure that our needs as states remain front of mind. As I mentioned, we had a very constructive, open engagements toward the end of the week, both in the White House on Friday and on the phone Friday night, and the Vice President complimented our state's aggressive and proactive stance. Tomorrow, I will convene a series of calls with stakeholders across our state to update them on our preparedness efforts and to ensure we are all working from the same playbook. One call will be with school superintendents and the leaders of our colleges and universities. The second will be with representatives of our business community. And the third will be with local and county officials. Of course, we are in the midst, and it bears repeating, of cold and flu season, and residents with respiratory ailments are more likely to be suffering from a cold or flu and not coronavirus. As of this moment, as I mentioned earlier, the overall risk of coronavirus is low. The Department of Health is maintaining the coronavirus information page on its website, which can be found by visiting nj.gov/health. That's nj.gov/health. And the state's toll-free public hotline for any questions that residents may have also remains in service, and that number is 1-800-222-1222, 1-800-222-1222. We ask that any residents with questions or concerns make those, either the website or the phone number, their first stops. We are working closely with officials at the Port Authority, which operates Newark Liberty International Airport, to ensure that any passengers who may have been exposed to coronavirus are properly screened so they do not pose a threat to the public at large. Newark Liberty remains one of the nation's 11 airports through which all flights originating in China will land, and they are taking their responsibility to securing public health with the utmost seriousness. As you'll likely hear from John in a few moments, the direct flights have stopped. I think when we started this, there were 29 a day. There are now none, but we're still, the folks are still screening for passengers who have had China in their travels and are coming in through a different port. We also recognize that the threat of the coronavirus is not just to public health, but to our economy as well. The global data is showing us this in very real terms. This is another reason why we will remain fiscally responsible to ensure that New Jersey's financial footing remains sound and based on sound practices, and so we have resources available through both our surplus and the rainy day fund to protect against any economic emergency. To residents, the surest way you can protect yourself and your loved ones and friends is to wash your hands frequently with soap and water, to be smart and cover your cough or sneeze, not with your hand but in your sleeve, and to avoid touching your eyes, nose, or mouth. And if you feel under the weather, take a day off from work or school and check in with your doctor or local health care provider. As we said, it is most likely a cold or seasonal flu and not the coronavirus. Only those who meet the CDC's criteria will have specimens tested at the state public health and environmental laboratories, which received federal approval late last week to begin coronavirus testing. All of us up here keep safeguarding the public's health as one of our highest priorities. We take the health and wellness of our 9 million fellow New Jerseyans as seriously as we take the health of our families and ourselves. My message to you is this: we've been at this for weeks and we are prepared and we are staying vigilant. A friend of mine had a phrase that I latched onto. It is no time to panic, but it is time to be prepared. I've said for weeks that our state of readiness has been a whole of government approach, and it'll continue to be that way, and we have your backs. With that, I'd like to invite Health Commissioner Judy Persichilli to come onto the podium and give us a few words from her perspective. Thank you, Judy.
Thank you, Bill. Good afternoon, Governor Murphy, fellow cabinet member. The Department of Health continues to monitor this rapidly evolving and expanding situation. Cases continue to rise across the globe and in the United States. Globally, there are more than 87,000 cases and more than 90 cases in the United States. So far in New Jersey, 8 people have tested negative for novel coronavirus. We've just recently have 1 individual under investigation. We expect specimens to be delivered sometime later today, and that person will be tested. That individual is not hospitalized, and at this point is afebrile, and more than likely, and we're hoping that that will be a negative test. Although this novel virus is understandably a cause for concern, it is important for New Jersey residents to know that the risk to the general public is still low. We are working closely with the CDC and our public health and healthcare partners to ensure our preparedness levels for this novel virus. At the Department of Health, we responded immediately, and on January 24th, we created an internal crisis management team that has met daily since January 24th. To help inform the public, in late January, we opened a coronavirus hotline. The call center has answered more than 850 calls from the public. They operate 24/7 at 1-800-222-1222 and can accommodate callers in multiple languages. In early February, Governor Murphy signed an executive order establishing a coronavirus task force to coordinate all state efforts to prepare for and respond to the public health hazard posed by this virus. This is a whole of government approach, and at this point, we meet weekly. The department has held a series of conference calls with local health departments and our hospital partners to review the importance of planning for this crisis. The department is working closely with our sister agencies. Given the potential impact on schools, we have met with the Department of Education, and we are creating a specific subcommittee dedicated to school emergency preparedness. As you know, hospitals are on the front line of this response. We've met with the hospitals and the New Jersey Hospital Association to go over emergency preparedness and resiliency, and we are actively working with the New Jersey Hospital Association and the hospitals directly to ensure they have sufficient plans in place to prepare for and respond to a surge of ill patients or a supply chain disruption. The department has surveyed the capacity at our hospitals, and there are currently more than 700 negative pressure isolation rooms throughout the state available for patients with novel coronavirus symptoms. These rooms, also known as airborne infection isolation rooms, provide the necessary protections to prevent contamination throughout the hospital. The New Jersey Department of Health works with hospitals and local health departments through all of our respiratory virus and flu season and on hundreds of diseases and outbreaks that we are prepared to handle day in and day out. It is important to note the CDC has broadened the definition of persons under investigation to include not only individuals who have history of travel to areas with COVID transmission, identified by the CDC as those countries with a level 2 or higher travel advisory, but also includes hospitalized patients who come in with a pneumonia in which a cause is not readily identified. With this change, hospitals will be evaluating many more individuals. We are likely going to be performing more testing as well as confirming more cases. I also want to take this time to remind everyone that the flu continues to be a public health concern right now in our state. There is currently high flu activity statewide, and there have been more than 5,000 cases of flu and 2 flu-related child deaths. The same precautions that you take for the flu are exactly what you should be doing to protect yourself from the coronavirus. Use respiratory etiquette, covering coughs and sneezes with a tissue or a sleeve. Wash your hands often during the day with soap and water for 20 seconds. And stay at home if you are sick. If you have symptoms, you need to visit a doctor's office or an urgent care and emergency room, and you are able, call first and tell them why you are coming. I encourage the public to visit our website, nj.gov/health, for information on novel coronavirus. The website has fact sheets, answers to frequently asked questions, travel advisories, and guidance for businesses, universities, schools, and healthcare providers. New Jersey continues to work very closely with the CDC and local health partners to monitor this situation. We understand that the public is concerned, but I want to assure you that we are taking all steps available to protect the residents of New Jersey. As this situation evolves, things will change quickly, and we will continue to keep you informed. Thank you.
Thank you. Well said. Thank you, Judy. We're going to keep things moving along here because, again, I apologize for starting later. Please help me welcome Dr. Lisa McHugh, who's the Infectious Disease Epidemiology Program Coordinator. Doc, come on down.
Thank you, Governor. So first, I just want to give a brief update of where we stand to date. So in addition to several new cases that have been reported in states predominantly on the West Coast, including California, Oregon, and Washington State, there have been many recent additions this weekend, 2 individuals reporting confirmed cases, including New York City, Florida, and Rhode Island. So some of these cases have had direct travel to areas with known COVID transmission, while others appear to potentially have no linkages to those areas, indicating the likely potential of community transmission of the virus in these particular areas. So another common question that we get is, do we know more about the clinical illness? I'm sure you've heard many of us say that there's a lot that's still unknown, and we are still learning about this virus, but as new cases are being reported to us, we are garnering new information. Overall, the illness does appear to have a very wide range of severity, from cases with very mild illness, similar to the common cold, which does appear to be the majority of cases that are occurring, to those with more severe illness requiring hospitalization. Those with the most severe presentations have been in adults predominantly with underlying health conditions. Worldwide, thankfully, there have been very few cases reported in children, and of those reported of those illnesses in children, they tend to have been mild. Many are asking what New Jersey is doing to identify COVID in the state. And we are closely following guidance published by the Centers for Disease Control and Prevention in the identification and testing of potential cases. Based on the growing number of cases that have been reported, late last week, CDC modified the criteria as has already been discussed, which are evaluating these people for testing. Around the same time, we also learned that the State Public Health Laboratory had the ability to begin testing for COVID. As I mentioned, like all other states, we are using this new criteria provided by CDC to evaluate individuals. It's important to remember that these are screening criteria, useful in identifying persons that require additional evaluation. These are not diagnostic criteria for COVID-19. Patients meeting this surveillance criteria might have many other conditions, including influenza, other respiratory virus, and bacterial infections. We're encouraging healthcare providers to conduct a thorough clinical evaluation early in the course of their hospitalization to help us rule out some of these more common infections and other causes of lower respiratory tract disease. The new CDC criteria that we're now using is very broad, and it doesn't include not only individuals who have a travel history to areas with COVID transmission, as identified by CDC as those countries with a level 2 or higher travel advisory, but also includes individuals hospitalized for pneumonia in which a cause is not readily identifiable. This broad approach means that we'll have more individuals eligible for testing, but it also does not mean that every one of these individuals will be tested. Commonly, community-acquired pneumonia cases requiring hospitalization are fairly common and occur very frequently, and often there is not a known cause for their illnesses. The New Jersey Department of Health Communicable Disease Service staff is using information that we know about COVID, both its epidemiologic and clinical criteria, to determine who best fits this criteria for testing, especially in that group that does not have identified travel risk factors. As been previously mentioned, we've had 3 individuals who've been approved for testing over the weekend and have all been found to be negative, and our team continues to work with healthcare providers on evaluating and approving individuals that have been reported to us. With no confirmed cases in New Jersey, the risk remains low to the general population, but is slightly higher for those individuals who may have traveled to some of these areas where COVID transmission is occurring. And even though there are no cases and the number of detections remains small, as we begin to do this additional testing, it does remain likely that we may identify cases in the near future. And I know that individuals are concerned about COVID, but I want to assure you that all individuals at all levels of state and local government, as well as the healthcare provider community in our state, have been preparing for COVID-19. And should we identify a case or several cases, we are ready to respond and to begin to take necessary public health actions. I know all of this may sound like some bad news, but the good news is that we don't have any cases in New Jersey, and there are actions and preparations that you can take to begin to keep you, your families, and your communities safe. Schools and businesses should be preparing for ill students and staff, and we suggest that you review guidance materials that are on the CDC and NJDOH website on how you can best prepare your communities. As the commissioner had mentioned, individuals are recommended to take just key prevention for all illnesses. Frequent hand washing, avoid touching your face, covering coughs and sneezes in a tissue or your elbow, and stay home from school or work if you're sick, and if you are sick, avoid crowded public places. If you do become sick, monitor your symptoms at home by taking your temperature and contact your healthcare provider for medical advice. They can help you determine if it's necessary for you to be evaluated in a healthcare setting and give you steps that you might take to help protect others in that healthcare setting should you need to be evaluated. My colleague in a few will provide some additional details and steps on what additional steps you might do to prepare. And I just want to illustrate one additional thing in which we are not recommending that the average individual do, and that is stock up on masks. CDC is not recommending the routine use of face masks or respirators outside of the workplace setting, meaning in the community. These are reserved for our healthcare providers. Most often, the spread of respiratory viruses from person to person happens among close contacts, meaning about within 6 feet, and with prolonged contact. CDC recommends that everyday preventive measures that I've just outlined is what you should be following. You should only be wearing a mask if a healthcare professional recommends it. And this may happen when an individual is sick and is being evaluated in the healthcare setting. And again, this is to help protect others from getting infected from that individual that is ill. Thank you.
Thank you, Lisa.
All right, well, you've been watching New Jersey Governor Phil Murphy and other public officials give an update on the recent coronavirus outbreak. Stay with us here on CBSN New York for the latest on the outbreak as it develops and on our website, cbsnewyork.com.